January is Glaucoma Awareness Month, a time to raise awareness for the eye disease that impacts over 3 million Americans. And today, doctors in Chevy Chase are offering free screenings. Glaucoma and cataract specialist at Visionary Eye Doctors, Dr. Reena Garg, joins me now. Good morning.
Maureen, happy to be here.
Thank you. And of course, let's start with just an overview of exactly what is glaucoma, how does it affect vision?
Absolutely. So glaucoma is defined as a disease, as a series of eye diseases that affect the optic nerve and lead to permanent vision loss and eventual blindness. Now, how I like to explain this to my patients, I like to compare the eye to a lamp. If you imagine the eye is a light bulb and your brain is the power source, imagine you don't have a good cord connecting them. You won't see light. And just like that, the optic nerve functions as that cord that connects the healthy eye to the healthy brain. And just like any other nerve in the body, if there's any damage or loss of the optic nerve, there's no way to fix it or replace it. So that's why it's so important this month that we're raising awareness about the prevalence of glaucoma, because it's so important to catch it early and to treat it before it leads to real problems for the patient.
So how is glaucoma managed once it is diagnosed?
So that's a great question, and it's actually an exciting time for glaucoma. I remember when I trained more years ago than I care to admit, the conversations we were having with patients were very, this is a serious disease. You may have to think about some difficulties down the line as far as losing your vision. But since then, there have been so many advances. The mainstay of glaucoma treatment is lowering your eye pressure, which is actually different than your blood pressure. It's a completely different measure, a completely different metric. But lowering the eye pressure has been found to be the most effective way. The way that we do that, we have a series of eye drops, medications that the patients can use at home. We also have laser procedures, we have surgical procedures. It used to be that we had to wait until someone's glaucoma was very advanced before we could do anything. But thanks to innovation and science, there's so many things we can do right at the time of diagnosis to stop and halt the progression, to make sure that nobody ever has to lose their vision from glaucoma.
Indeed. So if people are worried that they might have symptoms of glaucoma, I would imagine the first thing to do is to get a screening. Who does the screening exactly? Who performs these screenings?
So great question. So typically it's your eye doctor. So your optometrist, your ophthalmologist, when you go in for your yearly exam, you should be getting a full dilated exam. A lot of times patients, they don't love it because when you get dilated for a couple of hours, it may be a little bit difficult to read. You may be a little bit light sensitive, but for a once a year check, it's totally worth it. When we dilate your pupils, we can see the back part of the eye. We can check the health of the optic nerve. We can check the health of the retina and look for all different kinds of potentially blinding eye conditions. So it's really important to make sure to get that done once a year.
Indeed, and you're doing free screenings today, right? Talk a little bit about that.
Yes.
Yeah.
Yes, absolutely. So today, the Prevention of Blindness Society is putting on a screening event at the Chevy Chase Village of Friendship Heights Community Center. It's going to be a great event. One of our local glaucoma celebrities, as we like to say, Arthur Schwartz, will be there from 10 to 11, giving a very informative talk for our patients. And then from 11 to 1:30, there will be an actual screening for patients free of charge, thanks to the Prevention of Blindness Society of DC.
And that's important to note, it's free of charge. And like you said, the screening is the first step towards prevention. And if you're at all concerned about glaucoma, you've got this free screening happening today. We put the information there on your screen. But doctor, just again, it is an easy process. You said they dilate the eyes and really you check for things. And it's really, your eyes are dilated and maybe out of source for what, about an hour?
That's it. Just an hour once a year. It's worth it.
It definitely is worth it. And we'll end it on that note. Thank you so much for your time this morning. Again, this is Glaucoma Awareness Month. And they've got free screenings, the information there on your screen. Dr. Garg, thank you again for your time.
Thank you.